Morning, friends. I'm again Arun Kakar. I hope you are not sick and fed up of seeing my face. It's always a pleasure to interact with you people. And today we are going to discuss something which is, you must be wondering, why are we discussing? Before I go on to the subject today, there are 5 kinds of people in this world. The first category are, they know everything. And they know they know everything. That's the best thing that one can have. Second best is, they know what they do not know. They are clear about it. They are willing to learn. Third is, they do not know what they know. And many of you, or many of us, are in this category. And the aim of this exercise, these teaching learning methods, is to make you aware that you know many things. You're not aware of this fact. And the last category are, they do not know what they do not know. If you know what you do not know is safe, but if you do not know what you do not know, that's dangerous. Most of you are in the category of, you do not know what you know. And some of these exercises are just to recapitulate, just to revise, just to make you aware that, look, man, you know these things. You just have to be conscious. And you have to come from a status that you do not know what you know to you know what you know. And this urinary catheters and urethral catheterization is a day-to-day exercise. It's a routine. We all do it. And many of us do it without realizing what we are doing it. It is a science, it's an art, how to catheterize, which catheter to use, what size to use. It's not that you don't know, but if you have to present it scientifically, you have, like appearing in examination, you get tongue-tied. You are at a loss of words. You cannot express. You feel as if you don't know it. It's not true that you don't know it. You don't know that you know it. And what we are trying to do by these so-called minor topics is to make you aware that, look, man, you know these things. Just have to pay a little attention when you are doing these things a little scientifically. Before we decide who should be catheterized, when should he or she be catheterized? Question is, which catheter are you going to use? Can you use the same catheter in all age groups, in all kinds of patients? After all, These catheters are all made up of some synthetic material. They have their reactions. So on the basis of the material that they are made up of, they are classified basically into red rubber catheter, which is a natural material, or a synthetic polyvinyl chloride, what is also called as plastic catheters. In scientific terms, we call them as latex catheters. You have silicone catheter, and you have got Teflon catheters. What's the difference between a latex catheter and silicone or a Teflon catheter? Latex catheter can be transparent, can be a little stiffer than the silicone or a Teflon catheter, causes irritation. Patients are sensitive or develop a allergic reaction to latex. Whereas silicone and Teflon catheters are practically non-reactive. They are smoother. You can leave them in the body for weeks without changing them. They do not cause irritation to the same extent as the latex catheter does. So it's important to know, are you going to use a latex catheter, or are you going to use a Teflon catheter? Mind you, silicone and Teflon are way more expensive than latex catheter. And if you're going to put a catheter just for 24 or 48 hours, would you use a silicone catheter or a Teflon catheter? Well, you can avoid it. You can do away with the latex catheter. But if you think you're going to leave the catheter for a period of weeks or months, you won't use a latex catheter because of attendant irritation, the infection, the encrustation. So it's important to know which type of catheter you are using. The next question that arises in the mind of a resident is, what size catheter should I use for this patient? Is there any way, is there any scientific parameter by which you can decide the size of a catheter? Does the height and the weight of a patient help you in deciding the size of a catheter? Does the age of a patient help you in deciding the size of a catheter? By and large, on a gut feeling or on our experience or as guided by our peers or colleagues, we decide the size of a catheter. On an average, for an adult male, we use a 14 to 18 French. For a female patient, we use 8 to 10 French. And for children, you use 6 to 8 French. The question is, what is French? What is 14? What is 18? One French is roughly 3 millimeter in diameter. Or is it a circumference? I think it's a circumference, yes. And for every increase in a size, you add by 0.3 millimeter. So French 1 is 0.3 millimeter. French 3 is 1 millimeter. The next question is, how do you decide the size of a catheter? The roughly a formula in children they have found out is, they have drawn a normograms, but you can't have a normogram everywhere. And the simple formula is weight in kilograms divided by 3 plus 4 is the size of a catheter in French. For an example, if the weight of a child is 6 kilograms, divided by 3 is 2 plus 4, that is a 6 French catheter should fit in. That's how you calculate the size of a catheter you're going to use. The question is, can you use this formula for adults? Well, roughly to some extent, yes, but not always true. A 60 kilogram man divided by 3 is 20, plus 4 is 24 French. 24 French is relatively a big catheter. It can completely occlude the lumen of a urethra, or if you passes, it may be difficult to negotiate it. So you use 14 to 18 French. This formula, weight in kilogram divided by 3 plus 4, is roughly applicable to children and up to the age of adolescence. Beyond that, by looking at the size of external meatus, you can get an idea which size of catheter you're going to use. The next question is, when to catheterize?